Hello friends, this video is on fever. Let me say at the outset, this video is primarily aimed at the first MBBS level. So if they get a short note on fever, what content should be included. So it may not have lots of clinical things, but very basic information and some related aspects. If it comes as a short note, then it may be divided into three parts. First will be the introduction, definition. Then the second part will be the physiology, pathophysiology, the mechanism of production of fever, and then the types of fever and maybe management. So let's begin. What is fever? Also called as pyrexia. It is a rise of body's core temperature. 98.6 degree Fahrenheit or 37 degrees centigrade. That's the normal body temperature. When it starts increasing and when the core body temperature increases, that is when we call it as fever or pyrexia. And why does it happen? The very basic understanding is that we have a fine balance between heat production and heat loss mechanisms. If this balance is tilted, heat production is greater than the heat loss mechanisms, then the body will generate heat, conserve heat, and the body temperature will rise, and that is when the fever will appear. Now, it is among the most common symptoms. Fever is a very common symptom when you seek medical attention. But the thing to be remembered is that it is a symptom and not a disease. Now, this is for a common man, in the layman's terminology. They need to understand that it is just a manifestation or a symptom. Fever is not a disease in itself, because I have seen in my clinical practice that once the fever appears, many people get worried. They start running helter-skelter and somehow they want to suppress this fever. So, is it a good idea that the fever should be suppressed? Is it a bad sign that the fever has come? Well, we may divide it into two sets of populations. In the case of adults, it is generally said that fever should come once in a year at least. And of course, you will manage it, treatment will be done. But fever is a sign that your immune system is working fine. Your immune system is working to fight off the infections. That's considered to be a good sign. So fever is not all that a bad sign after all. Only thing is, in the case of neonates, infants, or children under 6 years of age, yes, fever needs to be promptly treated. Body temperature needs to be controlled at the normal level, and it should be a prompt management, only because rise of body temperature in the case of infants and children, it may lead to the febrile convulsions, febrile seizures. Very often I have heard this term from my patients. Fever has gone into the head of the child. Yeah, it's a febrile seizure or febrile convulsion, and it may cause some temporary harm. It does not cause any long-term harm to the nervous system development or something. But yes, therefore, in the case of children, uh, it should be seen very carefully, and the treatment should be done promptly. Fever should be managed. But otherwise, don't worry if there is fever of any cause. Of course, it should be treated, it should be managed, and the working population, working class people, they want to manage the fever because they want to go to work, and therefore fever, since it's a discomfort to the body, they want to cause it to be settled down faster so that they can go back to work. Right, that was just an introduction about the fever and the perception about the fever generally. Now, let's add one more point to it. As I mentioned already, that fever is actually a good sign that your immune system is working actually. Uh, in the ancient times, or in the previous centuries, Fever was actually used as a treatment. Yes, fever was actively induced in certain conditions. Deliberately, the body temperature was increased. There were certain methods like injection of milk. Milk is supposed to have certain pyrogens which may cause rise of body temperature, or injection of malarial parasite also was a method of increasing the body temperature. So fever was deliberately induced as a form of treatment in certain conditions. Of course, that practice is no more existing, but yes, in the past, fever was seen to have some kind of a utility. For instance, particularly in the condition of syphilis, neurosyphilis, or generally syphilis, it was known that the Treponema pallidum, uh, the microbe that causes this syphilis, does not survive the heat, and therefore body temperature was deliberately increased. Fever was induced in this condition. Or let's say conditions of rheumatoid arthritis or arthritis related conditions. It's already well known that these arthritis and similar conditions, they exacerbate during winter seasons when the temperatures are low, and the patients feel better during summer season when the temperatures are high. So anyways, but that these are the past practices where fever was thought to be of some use actually. Okay, now talking about the clinical postings, this is just an additional point. When you are taking the history of the patient and you find that there is fever in the patient, how do you report it? When you report it to your teacher, never say temperature is febrile, because you have a card to be filled where there is pulse rate, respiratory rate, temperature, etc. And we used to always get scolded by our head of the department when if we said during the presentation temperature febrile. No, he would scold us saying that's a wrong phrase. Patient is febrile. That's the correct way of expressing the fever. Patient is febrile. It's a febrile illness. Patient is febrile. Don't you ever say temperature is febrile. Temperature has increased. Patient has fever, or patient is febrile. These are the correct phrases I remember from my days of clinical postings. Right. Now, in the clinic, how do you measure the body temperature? And you come to know about the presence of fever. There are various sites where you can measure the shell temperature or skin temperature in the axilla. You use the place the thermometer in the axilla or in the mouth. Place it under the tongue so that its bulb is touching the surface, and uh, keep it for maybe about 1 minute or so that you exactly see the mercury and see the temperature. Rectal temperature, particularly seen in children, and it's a accurate indicator of the core temperature, the rectal temperature. Uh, Also remember, in the case of fever, for every 1 degree rise of temperature, heart rate increases by 10 beats per minute and respiratory rate increases by about 4 to 5 cycles per minute. This is quite an obvious fallout of fever, tachycardia and tachypnea, because the metabolic rate would be higher and therefore oxygen should be supplied with greater amounts, and that's the job of heart and lungs. So heart rate increases, respiratory rate increases with this proportion. What are the causes of fever? Most common cause for any fever is the infection. Bacterial infections, viral infections are the most common causes of fever. Infections. We will see later on why infections lead to generation of fever. Then certain inflammatory conditions may also lead to fever. Certain malignancies are also sometimes responsible for appearance of fever. But commonest cause for fever is bacterial or viral infections. Now the important part from the first year point of view, mechanism of fever production. Why is it that the people have fever? Look, we have a very excellent and very efficient temperature regulating mechanism in our body. So homeothermy is very efficiently uh, followed or set, and the most important part in that is the hypothalamus. Our temperature regulation is the function of hypothalamus. Hypothalamic neurons, particularly the neurons that are involved in temperature regulation, they act as a thermostat and they have a certain set point, and fever appears because of resetting of the hypothalamic thermostat. The set point, which is normally at 37 degrees centigrade or 98.6 degree Fahrenheit, this set point is raised. Hypothalamic thermostat set point is raised, and that is when it is thought that the body temperature has to go to that level, and that is when heat is generated and fever appears. So why does it occur? There are certain pyrogens. Look, fever means pyrexia, pyrogens means fever producing substances. So bacteria, viruses, when bacteria are being destroyed by our immune system, the bacterial cell wall will be damaged and certain chemicals will be released, certain toxins will be released into the circulation or into the tissues, and they will be responsible for production of fever. Toxins like lipopolysaccharides, LPS, commonly involved. Let's see the mechanism. Bacteria or the breakdown product of the bacterial cell wall. Now this will be phagocytosed by our immune system. I have already highlighted this point that when the fever appears, it should be taken as a good sign that your immune system is working. So how? Phagocytosed by the lymphocytes or macrophages, these bacteria or their components, and then there is formation of prostaglandins. Particularly involved is PGE2, and the most important cytokine which is formed is the interleukin 1. It's a cytokine, and as it is formed, then immediately it will generate the mechanisms responsible for fever. Locally in the hypothalamus, when the level of interleukin 1 will rise, then in no time there will be appearance of fever. And how does that happen? This prostaglandin and then interleukin 1 particularly, it will raise the hypothalamic thermostat. Its set point will be raised to a higher level, and that is when temperature increasing mechanisms will be activated by the hypothalamus. For instance, hypothalamus induces shivering to increase the body temperature. So such mechanisms will be activated within no time, and then fever will appear. So it's the hypothalamic thermostat, or let's say hypothalamic neurons involved in the temperature regulation. They are responsible for production of fever, and particularly important in this context that you must write is the interleukin 1. It's a cytokine, and that is causing this resetting of the thermostat. Right. Now, one more associated point that should be highlighted is that certain fevers are associated with chills and rigors. So what's the mechanism for that? Look, uh, let's say normally the hypothalamic thermostat, it's set at 98.6 degree Fahrenheit. So it knows that if the body temperature increases, it has to be brought back to 98.6. If the body temperature is lowered, then it has to be brought back to 98.6. That's the set point. Now imagine that there is a fever. Hypothalamic thermostat has been raised now to a higher value, let's say 100 degrees Fahrenheit. Now this is a new set point for the hypothalamic neurons. So now it is known to them that the body temperature needs to be brought to the 100 degree Fahrenheit. So imagine that meanwhile, if the body temperature decreases by some means, let's say for example, you have taken some antipyretic medicine and the body temperature decreases, or because of the natural course of the fever, the body temperature has come down, then hypothalamic thermostat or its set point is at 100. So it thinks now that the body temperature needs to be not 98 but it needs to be 100. So it will induce the thermogenic shivering. It will produce that process shivering, and that shivering process induced by the hypothalamus will cause chills and rigors. So remember, chills and rigors are because of a temporarily elevated hypothalamic set point. Uh, it thinks that the body temperature should be 100. So even if the body temperature is trying to come back to normal towards 98, there will be chills and rigors and it will be raised towards 100. That's the mechanism or cause of production of chills and rigors. Now let's see the various types of fever. There may be a continuous fever, that is steadily increased body temperature. Then, this is seen in most of the viral fevers, that there is a steady rise of temperature or steady temperature. It's, let's say, 100, 101 degree Fahrenheit. So it is continuously at that level. Then there are remittent fevers. That is, the temperature fluctuates. You see the fluctuations in the temperature, but the temperature never touches the baseline. The temperature never comes back to normal. It's just the fluctuation. It will go to 101, it will come back to 99, again it will rise to 100 or 101. There will be fluctuations but never touching the baseline. Whereas the third type is intermittent fever. That is, fever comes and goes, and in the meanwhile, when the fever is not there, the temperature is normal. It is touching the baseline. That will be called as intermittent fever. So just understand the difference between remittent fever and intermittent fever. One never touching the baseline, the other one touching the baseline and then again rising, means fever reappearing. Let's see the examples. Like intermittent fever, classically seen in the condition of malaria. In the case of malaria, the fever may appear every alternate day or every third day with a gap of 2 days, then third day the fever again appears, or every fourth day. So accordingly it will be called as tertiary fever or quaternary fever or quartan fever. But point to be remembered is that in the condition of malaria, it's intermittent, which means during the fever episodes, the body temperature is normal. The other important types of fever, like step ladder pattern fever, classically seen in enteric fever or typhoid. Now in this case, we would call it remittent fever because the body temperature will not touch the baseline. It will not come back to normal. And it goes on increasing in a step ladder pattern a rise of temperature like this. It remains at a certain level, the body temperature, then it rises, then stays there for a while, then rises further. So that's another classic type of fever. Then you should also know about evening rise of temperature. Look, fever can be high grade or low grade. High grade fevers generally do not touch the baseline. But low grade fevers, they have a typical behavior, they have a typical course. Generally, the low grade fevers appear in the evening. So it is called as evening rise of temperature. What is the reason for that? The process that produces fever is very much there in the body. But in the morning, there is no fever and fever comes in the evening. The reason, of course, is the circadian rhythm of glucocorticoids in the body. You know, in the morning hours, 6 a.m., 7 a.m., 8 a.m., there are high ACTH levels and high glucocorticoid levels. And you know, glucocorticoids, they can suppress the process of inflammation. They can be antipyretics. That is, they can suppress the fever. So in the morning time, it would not appear, the fever will not be present. But by the evening, 6 p.m., 7 p.m., glucocorticoid levels fall, and therefore their effect will disappear and the fever will appear, and therefore it's going to be an evening rise of temperature. And one interesting fact, just to add here, is that this is for the people who have normal working hours. But imagine people who have work hours which are night duty shifts. For months and years they have nighttime working and daytime rest or sleeping. Then their circadian rhythm, their diurnal rhythm is it becomes opposite. That is, their steroid levels are not high in the morning, their steroid levels are high in the evening and low in the morning. The rhythm gets becomes opposite, and because of that such people will have morning rise of temperature, because in such people morning time the steroid levels will be low. Right. And finally, let's see the management of fever. Of course, this is beyond the scope for first prof level, first MBBS level, but just some guidelines. For example, treatment of cause. You know, we have already mentioned it, that fever is only a symptom. So, temporary giving of antipyretic is fine, fever will come down, but as long as cause is there, the fever will continue to appear. So, treatment of cause. Then the home remedies are very effective. For example, cold sponging. कहते हैं ना पट्टियाँ की है बुखार में, तो cold sponging over the forehead. Now this is decrease of body temperature by conduction. You know, conduction means when two objects are in contact, heat is transferred to the cooler object, and therefore cold sponging means temperature, body heat will be lost to that cold sponge, and then heat will be taken from various parts of the body by the blood circulation and will be lost from here. But the point to be noted is that the sponge temperature will keep on rising all the time when you place it for some time. So just intermittently soak it in cold water, then place it. Then after a while, repeat the procedure. Antipyretics. Most commonly, of course, non-steroidal anti-inflammatory drugs, aspirin and the related drugs. Paracetamol is the most common and most effective antipyretic which is in use. They block the formation of prostaglandins, block the enzyme action. Enzyme cyclooxygenase is inhibited by certain NSAIDs. So that was a summary of fever. If it comes as a short note, I've already mentioned it should be 3 parts and it will fetch full marks.